Yes, MK the guy. About the specific agents, we are talking about the camustin, lomustin, and streptazocin. We want to talk about the solubility, administration, indications, reactivity, and toxicity. As we are seeing the structures, for solubility, this one is lipophilic. Of course, even this one is lipophilic. According to the structure, you can see the structure, the pro-ethyl group and the pro-ethyl group present, also the cyclohexane. This one, because of the presence of the OH groups, this sugar, it is hydrophilic. Of course, those are the reasons we talk about the OH groups of the sugar. Then we talk about the chloroethyl group. That chloroethyl group. Also, we talk about the cyclohexane. When it comes to the administration, this camustin is highly lipophilic. So administration, it's either directly into the CNS through the biodegradable wafers. Through the biodegradable wafers. Directly into the CNS. Because it is lipophilic, or it can be administered IV. But since it is highly lipophilic, the IV administration will require some ethanol. It is administered in IV, but in ethanol, because it is highly lipophilic, it cannot dissolve in the blood by itself, so it requires ethanol. For lomustin, it can be this one, since it is, we have the chloroethyl group, but also we have the cyclohexane. We said that this chloroethyl group is highly electron withdrawing. It increases the reactivity of the drug, meaning we shall have the carbocation. Yes, we have the reaction taking place. But for camustin, we have 2 of them, but here we have only 1, and we have the cyclohexane. This reduces the reactivity of the drug, since that's one of the chloroethyl group, meaning that this one can be administered orally because it is lipophilic, but it's not as reactive as the camustin. So it is present as oral formulation in capsules. As capsules. This one, the camustin, can degrade within 15 minutes when it's taken orally or when it's administered. But this one is a little bit higher, it has higher lifetime, so it can cross the membrane to the system. Then for streptazocin, this one is administered IV. But due to its highly hydrophilic groups, it is administered IV, either in dextrose 5 or in normal saline. It's administered IV, but in normal saline or dextrose 5. Of course, the reasons we talked about the OH groups, then the chloroethyl groups. When it comes to indication, camustin, since it is highly lipophilic, can be administered directly into the CNS. So indications, it's for brain tumors. That's one of them. Also, it is administered IV and can go to the lymphatic system. So it is used to treat Hodgkin's disease. Hodgkin's disease. Camustin is also used in non-Hodgkin's lymphoma and also in multiple myeloma. Lomustin is also used in brain tumors because of the lipophilicity of the drug, though it's not as lipophilic as the camustin. Also in Hodgkin's disease. Hodgkin's disease. For streptazocin, presence of this structure, this sugar, it brings the specificity of this drug to treat the carcinoma of the pancreas, which is the metastatic islet cells carcinoma. It is specific for this carcinoma of the pancreas. Because of this structure here. Of course, those are the reasons for their indications. Then for reactivity, of course, this one is highly reactive. It has the highest reactivity because of the two chloroethyl groups. Then this one, of course, it will have also it will be highly reactive, but this one is higher than this one. This one, because it lacks the chloroethyl group, it has none of them. Here, it has the sugar molecule, and here it has the methyl group. So, reactivity is relatively slow. It is slow reactive. Then, toxicity. These two, they have a pulmonary toxicity, which is dose related. And of course, with time, it increases with time. Also, they have the effect on the platelets. May have the thrombocytopenia. And also, leukopenia. So, thrombocytopenia may have bleeding. And for this leukopenia, we may have the secondary infections. For these camustin and lomustin. Then for streptazocin, since it is highly hydrophilic, we can have high concentration in the kidney. So it may lead to kidney failure. Of course, other side effects or toxicity, for all, we may have the myelosuppression. Though for streptazocin, it's rare, but it can happen, of course. The myelosuppression. Of course, even these ones can lead to myelosuppression. To overcome this effect of the kidney failure, because of high concentration of the drug, we need good hydration when we are taking this drug. Good hydration. If a patient is taking that drug, should take a lot of fluids. Also, the weekly checkup of the kidney function. Those are the few things we can talk about these three drugs. I think we can meet in the next video. Yes, same the guy. Thanks for watching. Please subscribe, like the video, and comment. Thanks so much.